All right, let's start talking about the menstrual cycle of a female. So when you're talking about the menstrual cycle, you're not just talking about when she is bleeding, right? It's the entire cycle from the time she starts bleeding till the next time she starts bleeding. That is a full menstrual cycle. And there are different phases in the menstrual cycle. The first phase is called the follicular phase. The follicular phase is the first 2 weeks of the cycle. This is when she actually starts bleeding. So day one of the bleeding portion of menstrual cycle is called is the beginning of the cycle. So that is considered day one. Start bleeding, that's day one. And like I said, that is the follicular phase. So menstruation, when she's bleeding, happens during the first few days of the cycle. This is when the uterus is going to shed the lining of the endometrium because there was no implantation of the fertilized egg. So basically the body's like, all right, we didn't get pregnant. We don't need this extra tissue. Let's get rid of it and let's build it up for the next try. Maybe we'll get pregnant next time. So that's what happens. Ovulation, when she is fertile, occurs around day 14. So approximately 2 weeks after the first day she's bleeding is when she is fertile. That is ovulation. Once she ovulates, once the egg actually leaves the ovary, then the remainder of that follicle becomes what is called the corpus luteum. The corpus luteum. Then you have the next 2 weeks of the cycle. The next 2 weeks are called the luteal phase. So in that phase, the corpus luteum that was created from, that was what was left in the follicle after the egg was released, the corpus luteum will then stimulate the endometrium to start thickening again. So then it continues to thicken, waiting for an egg, a fertilized egg to implant, because remember the egg was just released. And if it does not implant, then again, that endometrium breaks down. So that's how she will start bleeding again. So this is the cycle. Now, we'll talk about the cycle being 4 weeks long. And that is what we consider average or typical. 2 weeks of the follicular phase, 2 weeks of the luteal phase. But not everyone has a 28-day cycle. So if you don't have a 28-day cycle, or you know someone that does not have a 28-day cycle, it's not necessarily a problem, unless it is, but it's not necessarily a problem. Cycles can be 28, 30, 31, 32 days, could be 24 days, 25 days. So there is some variability. But when we're talking about it, we usually talk about 2-week follicular phase, 2-week luteal phase, equaling a 28-day cycle. So just keep that in mind. So in the follicular phase, that is when, again, you begin bleeding until you ovulate. So that's approximately 14 days. That includes the pre-ovulatory phase. The pre-ovulatory phase is after you finish bleeding until ovulation. That is called pre-ovulatory phase. The most variable part of the cycle is this follicular phase. And it's not always easy to predict when you're going to be fertile or when you're going to ovulate, but at least you know approximately when it's going to happen. So for those people who want to plan their pregnancy, who want to get pregnant and want to optimize everything, then they will start to track this so that they can know when they are most fertile. All right. or what times of the month they are most fertile. So FSH, follicle stimulating hormone, will stimulate these follicles that the eggs are growing in to grow and secrete estradiol. There will be more than one egg that is going to begin to mature, but that dominant follicle will become more and more sensitive to both FSH and LH, as well as estradiol. That dominant follicle is going to have lots and lots of blood supply so that it can get lots of nutrients. There's going to be more FSH receptors so that it can receive the signal that it's supposed to from FSH, and it will become that pre-ovulatory follicle. The other follicles will then degenerate. That is called atresia. So those other follicles, which are what it means when it's talking about the antral follicles, they'll degenerate, and that's called atresia. So the ovary also has follicles at earlier stages of maturation in future cycles, right? Because you have more than one follicle that is maturing at the same time or getting ready to mature at the same time. Ovulation is when that mature follicle actually ruptures, meaning that it opens up so that the egg can be released. Attendant cells are those other cells that are surrounding the egg that will help that egg do what it needs to do. So ovulation, the rupture of the mature follicle, will occur approximately around day 14 of your menstrual cycle. Estradiol, E2, will stimulate an increase of LH or luteinizing hormone. There will also be an FSH spike. It'll be a lesser spike than the LH surge, but there will be an FSH spike, both of these occurring by the anterior pituitary. Remember, the anterior pituitary is that master gland. It's going to produce hormones that are going to stimulate other glands and tissues in the body. And it is the one that that produces FSH and LH, so that in females, it can help to regulate the menstrual cycle and potentially help you become more fertile and receptive to producing the egg and getting pregnant. LH will cause several things to happen. One, that primary oocyte. So oocyte is the egg. That primary oocyte will complete meiosis 1, which will produce a secondary oocyte and a first polar body. So you have the primary oocyte. It'll go through this meiosis division, meiosis 1, and from that, you're going to get a secondary oocyte and a polar body. Then you'll have more follicular fluid that will build. It's going to build pretty quickly. The follicle is going to swell. That's going to make it look like a blister on the ovary, but it's not a blister. It's just this process. You'll have macrophages and leukocytes that will secrete enzymes that will weaken that wall of the follicle. And then you will have this nipple-like projection on the surface of the ovary. So I know this looks like a scrotum, but this is actually an image of your pituitary in the brain. So this is the hypothalamus. This is considered the anterior pituitary. This is the posterior pituitary. It is, you're getting GnRH secretion that will stimulate LH and FSH. That LH and FSH are going to go through the bloodstream and stimulate your ovaries. The ovaries, you have maturing of several ovaries. One of them is going to become the actual mature ovum that is going to be released for possible fertilization. So go through these steps so that you can make sure that you understand what's happening in ovulation. Ovulation itself only takes a couple of minutes. So during the process of ovulation, you're going to have follicular fluid that's going to kind of seep for a couple minutes. Then the follicle is going to burst. Whatever the rest of the fluid is that's in that follicle that was in the follicle, it's going to start to flow out, and it's going to carry the secondary oocyte and the cumulus oorophoros with it. Then the secondary oocyte is going to be swept up by a ciliary current and taken into the uterine tube or the fallopian tube. And it's going to be swept up by the action of the fimbriae. So the menstrual cycle consists of a buildup of endometrium during most of the sexual cycle, meaning that once your endometrial lining sheds, then from that time until the time it bleeds again, it's building that entire time. So you have 3 to 7 days of actual bleeding, and then you have up to 21 or more days of building that endometrial lining. So you have 4 stages of your menstrual cycle: proliferative phase, secretory phase, premenstrual phase, and the menstrual phase. The first day of the menstrual cycle is, of course, as I mentioned before, the menstrual phase. It lasts average of about 5 days. For some, it's as little as 3. For some, it's as much as 7. It could be more. If it's anything more than 7 days, usually it's going to be treated by a medical professional because that is more bleeding than should happen, and it could cause problems down the line, like anemia, etc. So that first phase with the noticeable discharge, meaning bleeding, is your menstrual phase. Then you have your proliferative phase. The proliferative phase is when you rebuild that functional layer of the endometrium. At day 5 of menstruation, the endometrium is about 0.5 millimeters thick. And the only thing that's really there is that basal layer, the basal layer. Make sure that you are looking at a ruler or tape measure or something so that you can know how thick 0.5 millimeters are, so that you can get a better visual of how thick that, or how thin that endometrial lining is just after menstruation. So as a new cohort of follicles develop, they'll secrete more estrogen, meaning once you start and finish bleeding, there will be another group of follicles that are getting ready to go next, to possibly be that primary and secondary oocyte to be developed. All right, and so those follicles will start to secrete more estrogen. That estrogen is going to stimulate mitosis in the basal layer and help to regrow those blood vessels so that you can regenerate that functional layer of the endometrium. By day 14, that endometrial layer should be about 2 to 3 millimeters thick, as opposed to the 0.5 millimeter thick that it was at around day 5. So the estrogen is also going to stimulate endometrium to produce progesterone receptors so that your body can receive the signals from the estrogen surge that is about to happen. So this is basically what your menstrual cycle looks like. We'll start with the bottom one. Here is the beginning of bleeding. So this is day 1. You have this buildup. You've already had this buildup of your endometrial layer, no fertilized egg implanted in the endometrium. So your body decides that it needs to get rid of this so that you can start over with next month. So once your body says, okay, no egg fertilized, implanted, let's go, you'll start to bleed. This is where your menstrual fluid is. This is day 1 of your cycle. Bleed typically 3 to 7 days. And then your body has to rebuild that menstrual lining, that endometrial lining. And so that's basically what's happening over all the rest of the days. Approximately day 14 is when you have ovulation and release of the oocyte for potential fertilization. This lining is going to continue to build until it reaches its maximum around week 3. After the 3rd week, it's going to get ready to be released again, since if there is no fertilization of the egg. So then we go through this cycle again. You have this lining that needs to be shed. And so it's getting ready to be shed. This is the premenstrual phase. And then you go back to day 1 where you start the bleeding. So what's happening is your progesterone levels are low, your estradiol levels are low. Your estradiol levels will start to increase around day 9, 10, etc. And close to day 14, your estradiol levels have peaked. This is when you ovulate. So ovulation is occurring because these estradiol levels are peaking. The ovum is released, so the estradiol levels can decrease. And then you have a bit of a plateau for the secretory phase of your menstrual cycle. And it remains at that consistent level for a few days until your body is ready to shed that endometrial lining. Then your estrogen levels dip to allow for the release of that lining. And then after a few days, it starts to increase again as you're building up that lining again. The progesterone will increase after ovulation in preparation for fertilization, should it happen. So it will elevate, it'll stay elevated for a while in case you get pregnant, in case the egg gets fertilized and implants. So it stays there. And if your body realizes that there is no implantation, then that level will drop as well. And the drop in both of these will allow for this premenstrual phase so that it can get ready to shed. Then you start the cycle again with your shedding, etc. So we talked about what happens if you do not get implantation. If you do get implantation, fertilization and implantation in this phase, right, in this area, if you do get pregnancy, the word for pregnancy is gestation, which is why when we talked about gestational diabetes, that's what we were talking about, diabetes that occurs during pregnancy. So gestation lasts about 266 days from conception, all right? Approximately 266 days from conception. Gestational calendars will measure it from the last day of the woman's last menstrual period. Because we usually don't know when she was fertilized and the egg implanted, they basically use the date of the last menstrual period to start counting the days of pregnancy, how long someone's pregnant. And then they will also use that to predict when she's going to give birth. So birth is predicted as 280 days from the last menstrual period. So on average, she is pregnant for about 266 days, but because we're using the calendar to measure how long she's pregnant, we're going to start it's gonna be approximately 280 days because we're looking at it from the last menstrual period. And if you remember, this is the menstrual period, and there's about 2 weeks from here to ovulation. And then fertilization is going to occur sometime in here. So this is roughly 2 weeks from when the last, basically the last menstrual period. And that's why you have this extra time, which is roughly 2 weeks difference from this and this. We say term for the duration of pregnancy. Full term pregnancy means that she was pregnant for the entirety of the 40 weeks from the last menstrual period. They break up the stages of pregnancy into 3-month intervals. They call it trimesters. So first trimester, second trimester, third trimester, because there are differences in how the baby is growing or how the fetus is growing during those particular months. So you have conceptus. Conceptus is all the parts or all the products of conception. This is the embryo or fetus, including the placenta and any associated membranes. All of that together is called the conceptus. You have the blastocyte. The blastocyte is when that embryo is developing at the very beginning of, right after fertilization. It is just a hollow ball of cells for the first couple of weeks. And that hollow ball of cells is called the blastocyte. After the blastocyte phase, you have the embryo phase, and the embryo phase is going to last from about day 16 post-fertilization to week 8. It's called an embryo. After that, that's when we start calling it a fetus, and it's called a fetus from the beginning of week 9 to birth. So the first 2 weeks of fertilization, it's a blastocyte. It is just a hollow ball of cells. After that 2 weeks, you're going to have an embryo from 2 weeks to about 8 weeks. After that, you're going to have a fetus from after 8 weeks to birth. The fetus is attached to mom by an umbilical cord that is connected to the placenta. This will provide the fetus with nutrients and will help the body, help the fetus get rid of its waste. It'll also secrete hormones that will help to regulate and make sure that the pregnancy goes the way that it should. It will help mom to develop her mammary glands, her breast tissue, so that she can actually feed baby once baby's born. And it'll provide what it needs to provide for fetal development. After the fetus is born, it is now a neonate. Neo basically means new. So a neonate is from newborn to 6 weeks. That is the neonatal period. So now we have to talk about the hormones that work in pregnancy. The hormones with the strongest influence are your estrogens, your progesterone, human chorionic gonadotropin, or HCG, and you have human chorionic somatomammotropin. All right, so those are the 4 strongest hormones that influence pregnancy the most. All of these are secreted primarily by the placenta. The corpus luteum will also be important for the first few weeks. If the corpus luteum is no longer available before week 7, then the pregnancy terminates because the corpus luteum is such an important source of hormones. From week 7 to week 17, that's when the corpus luteum will start to degenerate and the placenta will start to take over all of the endocrine function. All right, so first 7 weeks, it's the corpus luteum that is found in the ovary. After that, the placenta takes over so that all the hormones that are needed to sustain the pregnancy and grow the baby are going to be adequate. Human chorionic gonadotropin, or HCG, is secreted by the blastocyst itself as well as the placenta. It is detectable in urine after about 8 or 9 days of pregnancy or after conception. And this is why you do urinalysis, why you pee on a stick to find out if you're pregnant. So if you were to have sex and the sperm fertilized the egg and you took a pregnancy test in that first week after having sex, you're likely not going to know whether or not you're pregnant because the HCG levels are probably not going to be detectable, not until sometime after that first week. So day 8 or 9 and beyond, the HCG levels should be detectable so that you can know that you're pregnant. This is a qualitative pregnancy test at this time because you're not measuring how much HCG is in the urine. You're basically asking, is it there or is it not? Once she finds out that she is pregnant, then she'll go to the doctor to get a blood test to do a quantitative blood test. And the quantitative blood test will ask, how pregnant is she? How far along? And that's when they actually say, all right, we know HCG is present. How much is pregnant? Because there are different levels of HCG at different stages of pregnancy. HCG will also stimulate the growth of the corpus luteum. So remember that the HCG is being secreted by the blastocyst. And that's going to stimulate the corpus luteum. And the corpus luteum for the first, let's go back, for the first 7 weeks is going to take over the production of the hormones needed to sustain the pregnancy because the placenta is still being built. So this is why this is important, that the HCG stimulates the corpus luteum. And the corpus luteum will secrete that increasing amount of progesterone and estrogen. Estrogens. So your estrogens will increase up to 30 times the normal limit by the end of gestation or the end of pregnancy. So when we talked about the development of the male and female sex characteristics, remember I said that mom's estrogen levels are going to be higher the entire time that she is pregnant. So the determination of whether the fetus develops with male or female sex characteristics does not depend on the presence of estrogen, because estrogen is definitely present and estrogen is definitely high and getting higher throughout the entire pregnancy. That is why it is dependent on the presence or absence of testosterone, how the genitalia, how the characteristics will develop for the fetus. The corpus luteum is the source of estrogens for the first 12 weeks until the placenta takes over. Estrogens will cause tissue growth in both the fetus and the mother. The mom's uterus is going to get enlarged. The external genitalia is going to enlarge. The mammary ducts are going to grow. The breasts are going to increase to almost twice their normal size. And all of this is in preparation to house the uterus with the growth of the uterus. House the fetus. House the fetus with the growth of the uterus. Feed the baby with the growth of the mammary ducts. And then there's going to be a relaxation of the pubic symphysis so that the hips can widen when it's time for baby to be born. So look at your skeletal system anatomy so that you can remember where the pubic symphysis is, what it looks like, and that can help you understand how that pubic symphysis, which is the joint itself, will start to relax and allow the hips to widen in preparation for birth. Progesterone. Progesterone is secreted by both the placenta and the corpus luteum. Progesterone will suppress the secretion of FSH and LH. This will prevent more development of a follicle during pregnancy. So progesterone is being produced by the placenta and the corpus luteum. It's going to prevent follicle development during pregnancy. Let me go back. So when this progesterone levels are high, there cannot be any extra fertilization of another fetus because this higher level of progesterone is going to inhibit FSH and LH from doing their job. It's going to inhibit a new follicle from being able to be developed. This is why mom, while she's pregnant, can continue to have sex and not worry about getting pregnant with a second baby during that time. The elevated progesterone levels will also suppress uterine contractions so that baby is not born before baby's finished cooking. It's going to prevent premature childbirth, which is how it's going to suppress, why it's going to suppress the uterine contractions, because again, if she has uterine contractions, the contractions of the uterine muscles are going to try to expel whatever's in there, i.e. push the baby out of the uterus, and we don't want a premature baby. So progesterone, having adequate progesterone levels is going to help mom keep the baby in the uterus long enough for it, or longer, hopefully full term, so that it can develop. And it's going to prevent menstruation, which is, as we know, when the endometrial lining starts to slough off. We don't want anything in the endometrium or in the uterus to slough off and leave, because if this sloughs off, there's going to be little to nothing for the placenta to hold on to. And so then that mom can have a premature childbirth. Progesterone will also proliferate the decidual cells of the endometrium. These are the cells that the blastocyst feeds on, and it's going to stimulate the development of the acini in the breast. HCS, human chorionic somatomammotropin. This is where the placenta will begin to secrete about week 5. The amount of it will be increasing steadily until baby is born. Higher concentrations of the hormone. There is a lot of this hormone that is going to be produced. Again, it's going to keep increasing steadily until baby is born, but they still don't exactly know what it does. It seems to be similar to growth hormone, just a little bit weaker. It also seems to decrease mom's insulin sensitivity and insulin glucose, so that mom can leave glucose available for the fetus to use as an energy source. The pituitary gland will also grow. It'll grow to about 50% of its 50% greater size than normal during pregnancy. This will produce elevated levels of thyrotropin, prolactin, and ACTH. The thyroid gland itself will also get about 50% larger. Under HCG, pituitary thyrotropin, and human chorionic thyrotropin, which is produced from the placenta. This will increase the metabolic rate of both mom and fetus. So increase in the thyroid gland will increase the metabolic rate of mom and fetus. And then you have those parathyroid glands that are going to get larger and increase osteoclast activity. Remember, osteoclasts tear down bone, osteoblasts build bone. We will finish, we'll talk about the rest of these hormones on the next video.